Hello, hello. Good evening. What a wonderful evening. Today I take this opportunity to discuss a topic of interest. And this topic will measure a focus of interest where I'm going to focus what is the probability or what is the chance of being exposed COVID-19 if a person is vaccinated and is wearing a surgical mask plus a face shield, but is not wearing the I-95 mask in instance of working with COVID unit patients. So that is should be a topic of interest. I know most of us meet such situations. In healthcare, that is a topic of interest. I came across a case of such an age, yeah. And it's a polling case, and you imagine what would be the probability. Is there a chance? So, as we go through this, I'm going to dive into a situation that even those people who are vaccinated can be reinfected by COVID 19. That's a proven fact. But the symptoms may not be as severe as somebody who is not vaccinated. Now, my question today will be, what is the chance of a person? Let's say you say, I have an issue like asthma, so I cannot wear an I-95 mask, but I can wear surgical mask plus a face shield. The issue here is not about the underlying condition like asthma and surgical mask. The issue now, you're working with people who have been exposed to this disease, who have either current symptoms or have been, isolated for like a few days. So the question is, what is the chance of you being exposed to COVID-19? So this is a topic of interest and we must be very careful and examine it. To me, I won't risk if you're working in healthcare. If there are other options to avoid such a situation, I would prefer somebody like that to work in a different unit instead of such a unit because already these people have the, the disease. And for you to just assume that because I cannot wear I-95 because of asthma or certain things, I have no choice. You have a choice. You have a choice because you have family. You have a choice because you have others to protect, either the patients, either will be staff members, either will be your family, your children. Most of majority of us, we do have family. And for me to think that I would just, because I have a issue, I cannot wear the mask, I would just assume and work. Yeah, we need money, we need that. But health, health is a priority in any situation. Because think of your child, a young child, you get exposed, you take that disease home. For you, you may think I won't, for you, it may not be severe as the child or somebody else. So you think about another person. So this topic, I came across a case I was trying to reinvigorate and answer through my own self and ask myself, what is the probability? What is the chance? And how can we prevent such situations? If in any circumstance, what would be the best route of action? What would be the best action to prevent such issues? Because we don't want to have situations which will complicate the matter. COVID is very challenging. You can imagine we thought that by 2020 that was the end of COVID, but we still have cases. You can find one patient, a patient can come from the hospital, and the rest will get staff member and all everybody. You can imagine what are the cause of that. The cause will be you lose your hours of work. eh? You may take it home to your family. You may have a medical cost because some may go to the hospital. Think about that. What risk do we have to undertake to prevent situations that we can prevent? We cannot just assume. Assuming is not the solution. or ignorance is not a solution. Just because I want something like money, I can just risk when I have options. So this is the main topic. I hope it's a situation which can meet you and place because most of people work in healthcare. It could be your situation, it would be my situation, and we do have families. And our priority, not only to ourselves, we owe our health to ourselves and our families and our patients and anybody that we could come across. So we want to contain a situation at all costs, prevent it, reduce the chances of exposure, reduce the chances of spreading the infection to anybody. And that should be our ultimate goal. And that should be based on good judgment and good knowledge about the disease process. Brethren, I hope this message could help you in one way or the other as we continue to explore the nature of this trend of the disease, as we continue in our journey of exploring, understanding, and trying to contain it completely. It's our moral responsibility, you and me, to be active members of society, to prevent, to protect, and to defend. So may this message help you. Thank you.